know as humans we have our own DNA, right, which is just a map of our body essentially, but do animals have the same thing, and does it tell their story in the same way? Here for Critters Uncaged, U of I Wildlife Medical Clinic, we have Dr. Sam Sander, and as you'll see back behind her, a masked bandit, which usually when we do segments would be a raccoon, but in this case, it's not that at all.
Now, in fact, today we have Erica Bender. She is a third-year veterinary student and our senior manager for the Wildlife Medical Clinic, who's joining me today.
All right, I will freely admit off the top that I am in over my head trying to talk about DNA, certainly in terms of how it relates to animals, but you guys are using DNA on a regular basis to do what you do, so I'm just going to leave it there and let you jump in.
Well, actually, so most of what we're looking at and what we want to talk about today is how the DNA affects those blood cells and the blood cells that we look at to assess our patients. So when a patient comes into the Wildlife Medical Clinic, a lot of times people just know they found them and they didn't look okay, or they look sick, or maybe they have a broken wing, but something's not right and nobody knows quite what it is, and they don't have the ability to tell us. And so we have to do some investigating ourselves. One of the things we do for that is to get a blood sample and to look inside with that and on a microscope and see what's going on. We can tell a lot about an animal just by the blood cells, but there's also a lot of differences in those blood cells between the different species we care for. And we wanted to highlight some of that today. So on the microscope slide behind me, in that image, hopefully you guys can see it nice and clear, is the blood smear of a rabbit. So this is a patient that would have come into the wildlife clinic. But most importantly, I want you to notice that a rabbit is a mammal, right? And mammal blood cells are these really pale, circular, they kind of look like inner tubes you might want to flip down a river if maybe it wasn't freezing outside. And you would take them for a ride down the river, right? So the red blood cells in a mammal are nice and round, they're pale, and they've got this kind of inner circle where they're even more pale than the rest. Most importantly, they're one of the few cells in the body that don't carry a nucleus anymore.
So what would tell you, in the case of the one behind you, is there anything in that would indicate that that rabbit was sick or had something wrong with it compared to a healthy rabbit?
So in the blood smear behind me, this patient actually was anemic, so his blood cells were really, really low. And when we look at that on a blood smear, the cells are kind of spaced out pretty far. So just like we see here, there's a lot of gaps between those red blood cells, and sometimes that's apparent when a patient is anemic, just like in the case of this rabbit.
I guess the next logical question would be, you mentioned the rabbit being a mammal. Do non-mammals have noticeably different looking DNA? I'm assuming so.
Oh, indeed they do. And so I'm going to have Erica go ahead and switch the slide for us here. We've got an owl blood slide ready to go for you guys as well. This is a great horned owl who presented to our clinic only 2 days ago. He presented very, very skinny. He's got some eye changes. He's also anemic. But he's also got a lot of different things kind of going on. We're still trying to figure out what's going on with this case.
Those each look like slices of an avocado.
Yes, exactly. So burn blood cells are a lot bigger. They tend to be a lot darker. And then they've got a nucleus in the center, which is kind of the workhorse of the cell. It's where the brains of the cell are. And in birds, that is normal to have in a red blood cell. And it's mammals that have evolved to not have that nucleus in there anymore.
Well, I'm learning all sorts of things. I'm not sure how much I'm retaining, but this is fascinating information. Let's take a step back even further for someone who goes, I have found an animal nearby my house, out on a walk, whatever. I don't know what to do. I certainly can't be doing DNA stuff at home. What is the process for them?
So if anybody out there finds an animal that needs help, a wild animal that needs help, if you're in the area, you're welcome to give us a call and say, hey, I found this owl or something's going on. What do I need to do? And we can give you direction based on just that particular case. In lieu of that, you're welcome, as long as you can safely get a hold of the animal, whether it's with a towel or gloves, getting it in a carrier or something along those lines, please bring it to us at the Wildlife Medical Clinic so that we can do a full evaluation. We can look at the blood cells. We know what they should look like. We know all of the other parameters of a physical exam or other diagnostics we can do to make sure that that animal is safe and healthy and get them the care that they need. If you're not anywhere near the wildlife clinic, but you know that animal needs help, your local veterinarian and or animal control may be able to give you some direction as to best provide care for that animal.
All right, Dr. Sam and Erica, thank you guys. It's nice to have people with such expertise right here in our own backyard. You don't suggest trying to get a blood smear under a microscope on your own, right?
Definitely not. Even if you have a microscope at home, just like the cells show here, there's quite a bit of difference between, and most animals object to you getting a blood sample anyway.
I can imagine that's true. All right, guys, thanks so much. We will connect you at home with all the details. Just go to our website. You'll find their website and Facebook page at CILiving.tv.